So if you're pregnant or you work in the baby business, this one is for you. First of all, let's talk about that delicate tissue here, the perineum. So in 2026, a hospital team in Brazil followed 183 women who'd had an episiotomy, a second degree or a third degree tear after a vaginal birth. Every woman got the standard care, pain medication, anti-inflammatories and ice packs, just the usual. But some of them were also offered medical grade laser therapy, that's 808 nanometers, on the perineum once a day while they were in hospital. And this is where it gets interesting. So the women who choose the actual laser started off worse. Their pain scores were higher on day one than the women who said no to the laser. And yet over those first 3 days, their pain steadily came down, while the non-laser moms' pain slightly increased. So when they looked specifically at women who'd had 2 laser sessions when compared to women who'd no laser at all, they found an extra 1.7 point reduction in pain on a 0 to 10 scale. That's on top of the meds and ice both groups are already getting. And that's an important, statistically significant difference. Even better, they measured pain before and after each laser session, and every single time pain dropped significantly right after the treatment. So this isn't just, well, 3 days later I felt a bit better. This is, I had a session today and I can actually feel the difference when I sit, nurse, or I go to the bathroom. They also tracked early healing scores called the REDA score, and that evaluates redness, swelling, bruising, and how well those wound edges come together. The laser group showed a clear trend towards better early healing compared with standard care alone, and that's exactly what I see in my practice. So why am I telling you this? Well, because tools like that Solasta laser that I use has the same therapeutic wavelength, that 808 nanometers, along with red light to deliver a very similar kind of dose over the perineal area, but in a portable, mom-friendly way. So for doulas and midwives, this means we're no longer limited to, here's some ice and take your ibuprofen and hang in there, it'll get better. We now have an evidence-aligned, drug-free way to help soften those first few days after birth so women can sit, feed and bond with a lot more comfort.